Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about news and trends impacting the industry today. My name is Justine Giancola. I'm on the corporate communications team here at Inovalon, and joining me today is Boris Vabson on the research team at Harvard Medical School. Thanks for being here today, Boris.
Great to be here.
Before we jump in, just some context for our audience. Inovalon and Harvard Medical School are actually partnering to conduct a first of its kind analysis on the emerging Medicare population during the 1 year period before and after enrolling at age 65. And we're looking at insights like quality of care, member demographics, socioeconomic characteristics, healthcare utilization, how health inequities impact this topic. So, really extensive insights that we're gaining, and excited to dive a little deeper into this today. So, Boris, let's go ahead and get started. I think one of the biggest questions right now is what are the differences that have been identified between those who enroll in Medicare Advantage versus fee for service, and what does that mean for future enrollees?
Absolutely. So, uh, in the past, there's been a lot of open questions, unanswered questions around just how these populations differ. There's been a lot of speculation and leveraging Inovalon's comprehensive data set. We were able to actually bring specific, data and insights to this question. We found that the Medicare Advantage population faces a number of different socioeconomic disadvantages relative to those who eventually enroll in fee for service. So, at the time that these populations are choosing MA versus fee for service at 65, the MA population is facing lower levels of income. They're facing substantially lower net worth. They're living in areas that have fewer amenities, less access to different kinds of amenities. So just um, a wide variety of disadvantages.
Okay, so the study also revealed that Medicare Advantage reduces utilization and improves overall efficiency when compared to fee for service. So when we're looking at health plans and policymakers, how can they take this information to improve both of these programs?
Absolutely. So for policymakers, first of all, this provides a really strong evidence for the value of Medicare Advantage as a program. Some of the benefits that Medicare Advantage generates uh, for Medicare as a whole, and for policymakers and constituents. And it really, underscores the importance of maintaining the program and strengthening the program or continuing to support the program through different ongoing policy initiatives. And as for health plans, uh, this evidence, shows some of the areas where they're succeeding, and it can help health plans, potentially benchmark or identify additional areas for growth and improvement, building upon these successes that they already have.
That's wonderful. So what sort of quality improvements does Medicare Advantage deliver for beneficiaries, and where would you say that fee for service is maybe falling short?
Absolutely. So we looked at a broad set of quality measures in this study, and we found quality improvements under Medicare Advantage across a large number of these measures, but some of the most pronounced quality improvements were related to hospitalizations. So things like readmissions, preventable hospitalizations. Um, for those types of outcomes, Medicare Advantage really seemed to produce very, very pronounced improvement. And these are areas that fee for service itself clearly needs to do a better job on. And a lot of these shortcomings likely come from care coordination and just insufficient care coordination under the fee-for-service program.
Okay. Another major topic of conversation right now is around health inequities. And, I know there's some more research being done, but so far, are there any insights available from the study we've done regarding health inequities among Medicare beneficiaries?
Yeah, so that's a really great question, especially since health inequities have been really top of mind for policymakers and CMS in recent years. And we really looked at how health inequities play out in Medicare in terms of who's enrolling in Medicare Advantage versus fee for service, and how those groups compare in terms of their socioeconomic disadvantage. Again, we found that those in Medicare Advantage are substantially more socioeconomically disadvantaged. And one implication of that is that Medicare Advantage plans just have a harder job uh, ahead of them when it comes to managing these patients, because socioeconomically disadvantaged patients, you know, uh, entail a lot of challenges from a care management perspective that don't exist with less disadvantaged populations.
So, of course, we are excited at Inovalon at Harvard. We're excited for all the research, everything that we're learning. But where do you think the study fits in with the current healthcare climate as far as really taking this information and influencing policy and ultimately improving patient care?
Absolutely. So I think it fits in very centrally with the current policy debate, the current climate, because Medicare Advantage and Medicare in general is a top of mind issue for policymakers. It's top of mind given the size of the Medicare program, how many beneficiaries are enrolled in Medicare, the amount of federal dollars going into Medicare, and by that same token, the number of people and the amount of dollars going to Medicare Advantage, because over half of beneficiaries are enrolled in Medicare Advantage now, half of all Medicare beneficiaries, that is. So this is really, top of mind for policymakers, and uh, with something like Medicare, with healthcare, it's not just dollars or numbers of beneficiaries. Doesn't just come down to that. It also just comes down to life and death. Um, each and every day, and uh, in this study, a lot of the outcomes that we look at are pretty closely tied to life and death, like hospitalizations, readmissions, all kinds of complications, and so. Um, you know, uh, Given how closely this ties to just overall healthcare improvement for a broad segment of the American population, I think this is important and impactful work that we've been able to do with the Inovalon data.
Yeah, absolutely. We're so excited to be a part of it. And like I said, I know we've got more research coming. And I think that covers it for today. But Boris, it has been wonderful sitting down with you, taking a deeper look at the findings from this study. Looking forward to the additional insights that we uncover as this partnership continues. But thanks again. And thanks to our audience for tuning in today. Be on the lookout for our next INOvators episode coming soon.
Thank you.